Hey world, it's being able to come back with another video. Here in A-Sound family, it's another beautiful day. Probably get out and about and take the boys to the park, let them ride the bikes, get some exercise. You dig? I want to make sure I thank you guys again for subscribing to the channel, liking the video, sharing the videos. Very humbling. I appreciate it. This food for thought is important because, a lot of times, there's so much cognitive dissonance going on that, we really forget that it's really simple and easy to improve your life in every aspect, whether it's your finances or your health, and just, doing it eternally, you know. I think the biggest misconception we have right now, and like I said, I did a video a while back about how third leading cause of death in America, you know, uh, results from hospital uh, visits and medical errors, negligence and whatnot. It's not an accident, man. You hear so many times about people going to the hospital for a regular routine surgery or something like that and end up in a coma or end up dying. I mean, with anything, we put our faith so much into doctors. And I don't understand why, because, just like with anything, you have good doctors, you have bad doctors, you have people that are humanitarians, you have people that are not. You have people that get into the medical field for, ulterior motives, different reasons. And if you don't love people and you're a doctor, you only in it for the money. And so the system is kind of designed, family, where the three big dogs that really take advantage of our health and actually end up killing us more often than not is the healthcare system, the pharmaceutical companies, and the health insurance companies. I mean, they're all in cahoots. I mean, what system is designed where, you have to pay a premium every month to an insurance company so they'll cover your medical costs? Because without it, you wouldn't be able to afford medical costs. You wouldn't be able to afford it without the insurance that you have to pay a premium every month, with also stipulations that says that you have to pay $2,000, $3,000, maybe $4,000 out of pocket before that actually covers certain expenses, medical expenses and procedures. And then the doctor, who doesn't really treat you like a patient, the patient is every individual that sees the doctor, not every individual that comes in with certain signs and symptoms, and you just treat the signs and symptoms and not the patient. So many times, fam, you go to the doctor, let me ask you this, is this what they said? So how long have you been having this problem? Blah, blah, blah. Okay, do you have a past medical history? Yeah, my mom and dad had it. Oh, okay, okay. Are you taking any medicine? No. Okay, well, I'll tell you what I think it is with your past medical history, you may have a initial onset of high blood pressure, diabetes, because, you have a family history and this and that and the third. And then they prescribe you medication, which in turn actually, produces the high blood pressure and the heart problems. That if only we would have told you to start exercising more, change your diet, okay, more homeopathic situations. Drink more water. Make sure you, improve or increase your electrolytes in your system, because the family electrolytes are very important for your heart. But they are in cahoots with the pharmaceutical companies. Pharmaceutical companies are in cahoots with the insurance companies, and everybody is making money, and the one that's suffering is the patient. It's not an accident, family. Okay, so like I say, your health is your wealth. Uh, Something just as simple as making sure that you drink more water, drink more fluids with electrolytes. Increase your potassium intake, calcium intake. These are things that can actually help yourself be healthy, on such a minor level. Your vitamin C intake, you know. So, I mean, please, do your due diligence, because just to go to the doctor and have them prescribe you medications, and when you know that there are people going bankrupt because they can't afford medical bills, think about that. I mean, you would think that healthcare is a human right, just like food and shelter, with so many people with abundance. All right, family. In the meantime, between time, may the Most High inside to bring you joy. And being what is out of 5,000.